Welcome to Schuylkill Health in Pottsville, where surgeons have been using amazing new technology for gynecology, urology, and general surgery. It's called the Davinci Robotic Surgery System, the most advanced kind of surgical technology available, and it's right here in Schuylkill County. Doctors recently introduced the Davinci Robotic Surgical System at Schuylkill Health's South Jackson Street Medical Center.
The patients that I've performed the robotic procedure on so far all have been very happy, number one, with the short hospital stay, number two, with the lack of pain after the surgical procedure, or markedly less pain than they've had with prior operative procedures, and the fact that they're able to get back to their activities of daily living and their jobs a lot sooner than traditional surgery.
If you look at it as an instrument that simply is an extension of the skill set that the surgeon has, it provides an amazing capability, particularly, at least from the gynecologic perspective, particularly in specific areas. It's an excellent way to do a complete hysterectomy on a patient and have them walk out of the hospital either the same night or the next morning, and within 2 weeks be fully recovered from their surgical procedure and back to normal function. Patients generally seem to have less pain, less discomfort overall. They're back to their full function a lot faster, and I don't need to tell you that they're super happy about that. You know, we used to have ladies come to our office and say, well, what about doing my surgery robotically? And of course we didn't have a robot, so we would say, well, you don't need the robot to do that. We can do that the old-fashioned way. Now, we don't have to say that. You know, we have the cutting-edge robotic technology right here in Schuylkill County. The tiny little motions that I'm doing translate into the swing of those arms at the level of the patient. And by just simply going like this with my hands, I'm able to zoom in, and I can see the little dimples that in this practice dummy that's supposed to represent skin. I can see each little dimple, each little flaw. I can see each little thread in this suture, which is a level of magnification and precision. Like, I can actually peel off each little thread that makes up this suture, which is just crazy remarkable how much I'm able to magnify that view. So you can imagine that inside a patient's belly, with these tiny little motions of my hands and the kind of the swinging of those arms over there, we're able to do super precise surgical procedures. So when talking about endometriosis, I'm able to zoom in, I can bring in the camera, I can get super close to an implantation of endometriosis, and then with just some gentle traction and using maybe a scissors instrument, I'm able to cut out that implantation almost without having any bleeding at all, because you can actually see the blood vessels. If you look over here, just looking at this sample skin, which is of course not real skin, you can see these little teeny lines in here. You can imagine those lines are blood vessels. Well, I can actually see them with my eyes looking through the console at a level at which I would never be able to see with the naked eye.
Being able to come and having this technology available in a community hospital like our hospital here at Schuylkill Health puts us at a distinct advantage. And our main goal is to be a great community hospital, but still at the same time continue and stay ahead of the surgical curve and stay on the cutting edge of the advances in medicine.